15
So
to
it
16,000.
doesn't look like so it doesn't look like it's gonna go down by the 20th enough for the Metro Manila mayors to gain a little bit of confidence about loosening up a bit. It doesn't look that way.
It doesn't look that way, Lucci. We're hoping it would, pero maybe they'll have confidence. There's some pressure, I think, na i-move na to MECQ, maybe a strict MECQ. And kami naman, I mean, well, wala si Ranjit dito, who usually makes the recommendations. Pero our position naman is, well, we'll go with the decision of the IATF. But if we ease to an MECQ, it can still work. Pero we need to really scale up yung other other interventions natin, yung testing. We should be testing more. In fact, we should be doing more of parang closer to mass testing. And then yung contact tracing, we don't have data on that, pero dapat i-scale up din natin yan. Not just scaling up hospitals, pero yung mga early intervention strategies, yung isolation, testing, and contact tracing.
Professor, merong mga nagsasuggest kasi pwede kayong mag-granular lockdown eh. Pwede ba yung citywide lockdown within Metro Manila? How feasible is that? Kasi hindi naman lahat medyo napakataas, ano? Is that feasible considering the vaccination rate and the spread of Delta?
Citywide lockdown is, it's interesting. Well, alam natin Metro Manila is highly interconnected.
Yes.
So it would be medyo more difficult to implement. But, if they could do it, this would actually, be, maybe a worthwhile strategy to consider. And as we said, dumadami na yung vaccinations. Although sa San Juan, they're still getting their fair share of infections, even though marami na silang vaccinated. In fact, they have the highest vaccination rate per population, per capita. Pero they're still getting infected. And a lot of those who are getting infected are mga unvaccinated. And as we mentioned, mga 17 and below who are, yes, of course, also not vaccinated. So, pero, yun nga, I mean, this could be a strategy. I mean, kami naman, in terms of strategies, we, maybe we can look at strategies, pero we really just look at the numbers na, okay, pag may strategy tayo, we can tell you, is it effective? Is it working? Or we can tell you, oh, it's not working. And that's why, siguro, at that time when we were seeing a rise in numbers and it wasn't stopping, I mean, parang ang sinabi namin, well, wala na strategy nag-work, so maybe it's just the lockdown's the only strategy that will stop the rise in cases. Pero, if we have alternative strategies that will actually work, kasi ginagawa rin naman yan sa ibang countries. And in fact, I heard yung sa PCCI yata, sabi na, maybe we should think about yung data privacy and
Yes,
maybe
yes.
let's do electronic contact tracing. I would support that strategy. If it will help us beat COVID. We're just really looking at how to beat the pandemic. I don't know. Maybe we could waive the the Data Privacy Act or something. I know some people might not like that, but again, we're dealing with a public health crisis here. So I think whatever strategy will work or is viable, pwede rin naman tingnan yan.